published, 1702 EDT, the 26th of May 2018, updated, 1735 EDT, the 26th of May 2018. Karen Holford, whose rough cough was cured. A 15-minute radio wave treatment could give relief to people plagued with long-term dry coughs and sore throats. British doctors have pioneered an experimental procedure which has been a complete success for 90% of patients who have been offered it so far. Acid reflux, or heartburn, coughs and sore throats are a common problem and typically not an indication of anything sinister. However, some sufferers experience other symptoms such as hoarseness, excessive throat clearing, and globus, the sensation of a lump in the throat. For months and even years, they are often offered heartburn medication which is ineffective. Some studies suggest that in about 3% of these patients the discomfort may be due to abnormal cells on the inside of the esophagus, the tube that carries food to the stomach from the mouth. The condition is known as inlet patch, or IP, also referred to as cervical inlet patch, and the diagnosis is given when there are one or more abnormal areas on the inside of the esophagus. These areas contain cells normally found elsewhere in the body, including inside the stomach, and appear yellow or a pinkish salmon red when looked at with a medical camera, rather than the normal pale, pearl gray of healthy esophageal tissue. As many as 10% of the population may have IP, but in the vast majority it causes no noticeable difficulties. The condition is thought to develop in the embryo, in position. How procedure targets problem area. It is not fully understood why IP causes the acute symptoms, and little is known all about the long-term risks of leaving it untreated. The new minimally invasive treatment is known as radiofrequency ablation of symptomatic cervical inlet patch and is designed to destroy the patches, which can be up to 2 inches in diameter. Developed by gastroenterologists at Guy's and St Thomas Hospital in London, the procedure is carried out under conscious sedation. A probe is inserted through a tube or endoscope inserted into the throat and positioned next to the patch. This fires radiofrequency waves, a type of heat-producing electrical energy, at the area, eradicating the cells. The day case operation takes on average about 15 minutes. Consultant gastroenterologist Dr. Jason Dunn, who is leading research on the new treatment, has shown that 1 year after treatment, the patch had disappeared in 8 of his 10 patients. In the remaining 2, more than 90% of the patch had gone. After 14 months, there had been no recurrence of the patch or symptoms. Dr. Dunn says, the procedure destroys the unwanted tissue with no side effects. It is particularly suited to those people with symptoms who have not responded to heartburn medication. It is not fully understood why IP causes the acute symptoms, and little is known all about the long-term risks of leaving it untreated. One of the first patients to benefit from the new treatment is Karen Holford, 56, who first had symptoms about 4 years ago. The mother of 3 from Hemel Hempstead, whose job involves public speaking, said, I had a really rough cough that would go on and on. I would have to take each breath carefully to try not to trigger it. I had tests for all kinds of things, antibiotics, MRI scans, and bronchoscopies. Eventually, she was referred to a gastroenterologist who diagnosed IP and had treatment earlier this year. She says, it was easy and fairly pain-free. After 2 treatments, 3 months apart, I really noticed a difference. It has made my life less stressful and more comfortable. A new concept thrilled a nutrition geek within me this week, the introduction of healthy vending machines. Now, I'm not opposed to the odd chocolate bar or bag of Walker's Max, but, typically, the only options given by vending machines are sugary confectionery, caffeine and sugar-laden energy drinks and packets of salty crisps. I've got one such machine at my gym, and it does seem to defeat the object. So what's not to like about the idea of convenient grab-and-go snacks that are also a bit better for you? Well, my hopes of a healthy, post-workout bite were shattered when I learned what sort of products were available in these machines, launched at 13 Virgin Active gyms nationwide. Let's look at one offering. Ollie Bars Breakfast Bars. They contain 16 grams of sugar per bar, more than half the daily limit, and the calorie equivalent of 4 Oreo biscuits. Thirsty? Try a can of Fizzy Tenzing, a 100% natural energy drink. It's made with green coffee, herbal extracts, Himalayan rock salt, and a load of caffeine and 30 grams of sugar. That's just a little less than a can of Coke. Seems to me it's a case of same old vending machine rubbish, in slightly different packaging. Avocado energy balls and peanut protein bites are also on offer, for those interested in punishing their taste buds. While I appreciate the sentiment, this attempt at reprogramming snack culture seems to me like a missed opportunity. Harry's diet havoc. On Meghan's instigation, the pair were said to have opted for a liquid diet of fruit and vegetable smoothies. Harry, 33, shed half a stone. As much as I love I was rather disappointed by the new Duke and Duchess of Suss's alleged pre-wedding diet. On Meghan's instigation, the pair were said to have opted for a liquid diet of fruit and vegetable smoothies. Harry, 33, shed half a stone. But according to dietitian Sarah Ellis, juicing diets cause havoc on the body. She says, high levels of sugar in juice are linked to dental cavities and spikes in blood sugar, and when fruit is juiced, you lose the fiber. This diet is seriously low in protein and energy, meaning it won't fill you up. Why waste calories on juice when you could have a nice sandwich and piece of fruit for the same calories and micronutrient content? I'll give the royal smoothies a miss, thanks, and stick to a good old-fashioned coronation chicken sandwich.